in talking now, obviously coronavirus is a bit more serious. I think I just want to start with this idea that I think we were talking about before we got on about what's real, what's the level of hysteria that's going on, how much of it's justified, how much of the reporting is actually being done really well, how much of the various governments around the world, are they doing a good job with this, are they not doing a good job with this? And it just, the overall consensus, for me, if you try and meld all of that into a big ugly piece of soup or whatever and try and make sense of it, is that it just, you almost like don't know what the hell's going on.
No, and look, I think it's important for us to emphasise that the only place that you probably should go if you really want to get the information is the World Health Organisation. At least it's pretty dry what they report, but that's it.
All right. I mean, in terms of the actual stats and stuff like that, I mean, for Australia, it's, we've got, 59 confirmed cases at the moment and 2 deaths. And but the thing is that just, I don't know if you've been following some of that coverage recently, just if we talk about the hysteria level for the moment, seeing supermarket shelves being emptied of all toilet paper and tissues. And it's just crazy how some people behave in these situations. And I'm sure it's not just us in this country where this sort of thing's been happening. And it just, to the point where, I got an email from the CEO of Woolworths saying that they're on top of it and they're going to be limiting, how many items per transaction, blah, 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 and all that sort of stuff. And it's all this ancillary stuff that is quite crazy, really.
Oh, well, this is crazy. I mean, the coronavirus is very serious in terms of what it means. It'll be probably another seasonal illness, which has a mortality rate that will be added to the current list that's already there. So it's serious in that regard, but it's nowhere near serious enough to invoke this sort of panic. And I wonder, what are the motivations of people who go and buy toilet paper, or even stock up on food? No one's going to starve. You're not going to be cut off. And honestly, who, at least in Australia, wouldn't want to stay home for 2 weeks and work from home? So if and when that happens, it's not going to be a crisis. It should be an enjoyable time, a bit like Christmas, where you spend time with your family.
I guess the other thing to put into context as well is who it actually affects the most. So essentially, the older you get, the more susceptible you are to more severe symptoms, or if you take it all the way, obviously some people have died from it if they've been
that's right
not that good from it. But it's interesting that so kids under 10, for instance, like they could have it and that you'd never know, potentially, all the way up to like if you get 70s or 80s people that in their 70s and 80s who it could be a lot more severe. And it just seems to be a whole range. But the other thing that was interesting is, these sort of spikes that you see, like Italy the other day reporting that they had 50 deaths in one day. And it seems to be that type of headline that can tend to freak people out.
Well, that, and especially when it's amplified on social media. I mean, it's a very serious disease if you have a respiratory complaint, a chronic respiratory complaint. It's very serious, especially if you're older. But the reality is that it's out there now. It's around the world, and I would question how much we actually know about its spread, because you can only report it if you test for it. And so if there's no testing, it can be out there, and as you've just said, Ben, some people might not even notice that it's coronavirus symptoms. They might think they've got a cold, or they might show nothing at all. So I think there needs to be some balance in that, and there probably will be a time, I suspect, where they'll take some fairly unprecedented measures to try and stem the spread. But at the same time, it shouldn't be anything that concerns anyone.
Well, just on that, there's obviously been various criticisms of different governments around the world and the way they've been responding to it and all that sort of thing, almost like not head in the sand approach, but more like they haven't struck that balance of taking it seriously enough, or trying to say that it's, or trying to keep a lid on it when they should have just been up front in the beginning, that sort of thing, which doesn't help the situation either.
Well, I think, look, I think as we said last time when we spoke about this, this is unprecedented. So they're going through a process which they've sort of envisaged for probably a more serious, illness. But it's not nuanced, and governments have never had to deal with this anything quite like this globally.
Yeah.
The media takes the angle that it's as deadly as Ebola, and we should all be panicked, and what you end up with is a mess, people confused. There's been fake news about this virus on Facebook, and honestly, that's, to me, more serious than probably any meddling in a US election campaign.
Well, maybe yeah, exactly. Well, maybe we can finish on that point, this idea that we haven't had to deal with this type of thing in an age where so much disinformation is swimming around out there, and it's dangerous in a way, like you said, because it leads people down a thought process that is probably not valid.
It's not, and it's unreasonable, and it's downright dangerous. And I think it's time for our social media platforms to start thinking very carefully about their role in the content that they publish, even though they claim they don't.
Well, didn't we? I think we talked about it in terms of privacy, in terms of hacking information and stuff. But this is just as equally as important in terms of their responsibility, in terms of how to deal with this sort of stuff.
Absolutely. And the thing is that inadvertently the social media platforms are programmed to have maximum emotional impact on you. So, it's not even that, the platforms have, created this deliberately, although they have through advertising, but that same effect for misinformation or advertising is equal. And so, I think, I would hate to see a truly serious, disease situation or, pandemic, which resulted in disinformation that really risked public safety globally.